Welcome to the Southwest Florida Real Estate Update, hosted by the York Group of Downing Fry Realty. Our show will bring you the most up-to-date information on the local real estate market, presented by leading experts in the field.
Welcome to the show today. I'm here with Dr. Gregory Leach of Advanced Medical, and we're going to be talking about his practice here in Naples, and he's going to tell us a little bit about what he does here and his staff and how he can help the people in the Naples area when they're moving down here or people that have been living here for a while. Gregory, Dr. Leach, thank you for coming on the show today. You know, I've been dealing with you for 20 years, right?
Yeah.
We've been doing a lot
At
of things
least.
together, so at least 20 years.
Time flies.
And you've been serving a lot of our clients with your beautiful place here. So tell us a little bit about your practice so the people, the viewers can understand what you do and how you can help them.
Well, Advanced Medical is the name of our practice. It's a family practice. We do more than family practice.
That's right.
But it is primarily a family practice, but we are a 7-day-a-week family practice. It's 12 hours a day, 7 days a week. And our patients are by appointment, but also by walk-in. So, and many of our patients who are, walk-in, so to speak, they are our regular family practice patients, but we also have patients who are not that come in. But I'm a family practitioner. I'm of Florida, native from the Panhandle of Florida. I was educated in Florida, University of Florida.
That's right.
And I left and went out west for quite some time. Did training there, worked for the United States Public Health Service, and eventually ended up practicing emergency medicine, then ambulatory medicine, meaning non-hospital-based medicine, working for a large hospital system in Denver. So I knew that I wanted to practice that kind of medicine because I knew that outpatient medicine and inpatient medicine are separate entities and they don't mix very well. And today it seems that that's how things have come to be. But suffice it to say that I moved to Naples and started Advanced Medical Center in 1988 and been practicing since then. We have 2 physicians and 5, sometimes 6 nurse practitioners working 7 days a week.
And then how many staff members do you have? Because you have a large practice, so people can understand that you can help them in all different areas.
Well, we have about 70 employees.
That's what I thought.
So when you're 7 days a week, you have 2 shifts of people. We have the providers. We also have nursing staff, but we also do other things besides see patients. We do lab work. We have an accredited state of Florida lab that I started a long time ago within our facility, and we also have an X-ray suite. We also do bone density testing. We also do drug screening. So that requires quite a number of people and people that are trained to do those things. So.
And you're also doing testing for the virus too, right?
Yeah, we are doing viral testing for the current coronavirus epidemic. We're doing rapid testing, which is a 15-minute rapid, as they say, antigen test, a protein test. But we're also doing the PCR test, polymerase chain reaction. I always choke on that. That's why we say PCR. And then also the antibody test to see if people have developed antibodies to coronavirus. So.
And some of the testing that you're doing for that, you can do it through a drive-through outside, right? Now you've started that back up?
We did recently, and that's primarily because of volume or demand. When we during the initial surge of the epidemic in last summer, summer of 2020, we had such a number of patients, we couldn't handle the volume inside the building. So we took it outside, and patients, many patients preferred to be outside for any number of reasons. They just thought they were safer. It may or may not be true, but they thought they were. And it was quicker. So at that time, we were throughputing 300, 400 tests per day. Now, with this latest Delta variant surge, we've reopened our outside testing site to handle the volume that's needed.
So you would do annual checkups for people, right? So that they can come in. And,
Well, yeah. Well, within family medicine,
switching over.
many patients don't. Pardon me.
I'm switching over to another.
That's okay.
topic.
We'll switch back to family medicine. Many people don't really understand what's that mean, family medicine.
Mm-hmm.
I have an identical twin. He does what I do. He's a doctor. He's a family doctor, and he coined the term doctor of the whole patient, meaning you do everything. Unlike internal medicine, which restricts, anybody below 18, and in internal medicine, they're very well trained, but they're not going to sew your laceration up. They're not going to do your pap and pelvic exam. They're not going to do any of these fractures. I treated an elbow fracture last night. They're not going to do that. So we do everything. Mm-hmm. So that's what family medicine is. So we obviously, of course we do annual exams as part of that as needed, and whatever else is needed in between.
That's right.
There's always something that's needed, right?
And so let's just talk about the flu that's coming up. We're going into the flu season. You'd also do flu shots, right?
We do quite a number of immunizations.
That's right.
And any and all that one needs.
Mm-hmm.
Influenza, the quote shingles vaccine, which is obviously a chickenpox booster, but it is flu season. In fact, I just got my flu shot a few days ago, mm-hmm. and it's just about August, and it's uncommon to get them that early, but the CDC is recommending that we start early. So we have multiple types of influenza vaccines depending on the age of the patient. They're different, and patients have choice as to what vaccine they can get. Mm-hmm. So we are doing that, and we're not doing coronavirus vaccine right now because it's not packaged really for general use. They're packaged in 10-dose vials, and when you snap that cap, you have to give 10 doses within 6 hours. Otherwise, you waste it, and you can't be wasting that. So, but eventually they'll package it in a single dose. But yes, we do quite a number of immunizations.
So let's talk about somebody can come into your office if they're sick, with whatever they have. Mm-hmm. You're open 7 days a week, 12 hours a day. Mm-hmm. So for our viewers, I'd like you to recommend that somebody that's not sick, during the year, what is the best way for them to look after their health, and what kind of workup would they need during the year, or how often? And
if they're not sick. Mm-hmm. It depends.
Preventative medicine.
If they have diagnoses, hypertension, diabetes, hyperlipidemia, we usually see those patients every 6 months. Mm-hmm. We do their lab work every 6 months. We'll do their electrocardiogram, the heart tracing, once a year. We'll also do a chest X-ray if needed. Mm-hmm. So there's a certain amount of that maintenance going on, right. That we do. And whatever else is needed in between, because sometimes things change and then we end up having to do things more often if the diabetes is not controlled, if the blood pressure is not controlled. So yeah, we end up doing those maintenance type functions for those patients.
And explain a little bit, because I know, we've been friends for a long time, and you've treated lots of my clients and our family for a long time. And just explain to our viewers your philosophy on medicine, meaning that they also have to take care of themselves too, and you're the educator.
What a concept. Yeah. Well, if you think about it, I say to my patients, since I was in medical school, we've cured just about 90%. 90% of what was around is gone. That sounds like an exaggeration, but by the numbers, it really isn't. As an example, and I date myself a little bit, but when I was in medical school, in the third year of medical school, we were doing stomach surgery all the time because people would have ulcers, they'd be bleeding, and if the operating room board, which is a handwritten board, was twice as big as this wall behind us, taller than when you're standing up, and a large part of that board was covered with surgery for stomachs. So in the beginning of the third year of medical school, Tagamet was invented. Everybody knows Tagamet. It was the first true acid blocker known. At the end of the third year of medical school, there was no stomach surgery on the board. So if you multiply that, just that's a large number of people. Now you multiply that times all the complications that occur, other problems, and people dying. That is a huge number of patients. When I was in medical school, we had aspirin for arthritis. Ibuprofen was invented. So childhood leukemias are cured. So most of these things have gone away. Now we're dying of disease that much of the disease we have now is preventable disease.
Right.
And much of it is caused by the individual themselves. And that the disease that takes us down is we block our arteries. Arteriosclerosis, hardening of the arteries, many names. You can see changes in the arteries of very young people. In teenage years, you can see early changes of arteriosclerosis. And that is because of what we're eating, what we feed our kids, or as adults, and what we're not doing with our bodies. We're not exercising, we're not maintaining the body. So there are 6 things that will cause arteriosclerosis: smoking, diabetes, high blood pressure, cholesterol, family history, and obesity. If those things don't exist, most people don't get disease. And some of those things are caused by each other. Like high blood pressure is caused by obesity, and obesity causes diabetes. So you can eliminate a huge number, you can eliminate a majority of this disease. I should say the patient can eliminate the majority of that disease. Because, you alluded to the fact that, I'm an educator. And, well, I teach. I heal no one. Patient heals self. I teach. I already know this information.
Right.
My job is to teach the person, the patient, so that they have the opportunity to change. They might not change, but at least they have the knowledge. So many times I'll have a patient, an individual that comes to me, and they moved from somewhere to here, and I say, well, why are you here? They say, well, I have my blood pressure medicine, my diabetes medicine, and my cholesterol medicine.
Right.
Those are the 3 most common. And many patients don't even need to be taking any of that because they can make it go away to where they don't. But long story short, and they just say, well, I just need to refill my medicines. And I said, well, that's great. I can do that, but that's really not healthcare. It's maintenance. So healthcare is done by the patient, because if the patient cares for the body, there is no disease. Dis-ease. People don't want their ease dissed. If you use the slang, dissing, that's where disease word came from. So, when people are forward thinking and understand these things, they don't get blocked arteries.
Right.
Now, that's easier said than done. part of the problem is that we're not taught any of this. What are we taught? I know what I was taught. Grow up, get a job.
Right.
That's what you were taught.
Yeah.
And so we were not taught how to maintain the body. But what we need to, and it's not hard to learn at all, but if people make it one of their hobbies, so to speak, it doesn't have to be fanatical and crazy, but it can be done very easily. But that requires some change,
discipline,
and learning, and some discipline. And the difficulty is trying to do this when we're embedded in our society. That makes it more difficult because we have other things we have to deal with. People at home, kids, especially when it comes to food. So when we change as a patient and when we start eating differently or people around us don't like that. They want us to stay the same because people don't like change.
Right.
They say, well, why are you eating that? Or why aren't you eating the food that we're eating? And so there's a lot of pressure for people not to change. So it becomes difficult. Yeah. And you've heard me talk about it before.
Oh, yeah, I have.
Yeah.
I have. I preach to my kids all the time about.
Probably get sick of hearing me talk about it.
No, I don't. It's interesting. It's changed my life. I've lost 100 pounds.
Yeah.
I'm only joking.
Yeah, you haven't. They did autopsies on Vietnam casualties in the Vietnam War, and some of the casualties were 17 years old, maybe even 16, less commonly. They lied about their age to get in.
Right.
And those individuals, you could actually see what's called fatty streaks, which is the early signs, as I alluded to earlier, of arteriosclerosis.
Wow.
So even in the 70s, 60s, 70s, you could see that. And why is that? It's because we're eating food that is not fit for the human species. Right. Since the age of the freeing of the housewife from the kitchen in the 1950s, put that word in quotes, the age of convenience foods, the age of then fast foods, and then chain restaurants. Chain restaurants is nothing more than glorified fast food.
That's right, yeah.
It is equally not terrible food. Even though we just assume that's normal, it's not. And the volume of food is phenomenal in terms of the volume that people eat. The average caloric content in a meal at a Friday's restaurant is more, of one meal, is more than the entire number of calories that we should consume in one day. That statistic is scary.
Yeah, how about Cheesecake Factory? So,
Yeah.
But the plates have gotten bigger too. So bigger plates, more food. Smaller plates, less food, right? So
that's everything. And sometimes that big thing, and everything is bigger and bigger and bigger. People get trapped into. Well, I shouldn't say trapped. Maybe they are trapped into eating more because of the way that you put food in front of you, especially at a quality restaurant. They are smaller plates, or there's less food on the plate for beauty. In Italy, it's like that.
Yeah.
So we just need to get back to the way we used to eat. There was no obesity prior to 1950. Very minimal. And it's because people were eating more real food. And that is when agriculture changed.
Right.
Agriculture, small farms into agribusiness. When the Secretary of Agriculture, I think his name was Earl Butz, was quoted as saying to the farmers, "Get big or get out." So now we've got huge farms that might as well be hydroponic because the ground has been destroyed. So that in order to farm on that, you use a tremendous amount of pesticides, tremendous amount of fertilizer. And of course, that's poor quality food because it's has those chemicals embedded in it, and we're eating that. So that's not good stuff in large volumes. So,
Well, Greg, Dr. Leach, I'm happy that you came on the show today.
Yeah.
And this is something new for what we're doing in our real estate show. It's kind of like a circle of doctors or physicians in Naples that I highly recommend and used over the years and have a high regard to, and you're the top of my list. So,
well, thanks for having me, and thank you for asking me about my practice, and then we got off into health, and
that's what we're here for, to educate people.
We see many patients for acute care, for chronic care, for even health education that we just got finished talking about. So it really depends on what the individual wants or needs, and we guide them.
Again, thank you, and thank you for tuning in this week, and we'll see you next week. Thank you.
Thinking of buying or selling a home in Naples, Marco Island, Bonita, or Estero, Florida? Think of the most experienced York Real Estate Group, associated with the #1 brokerage in Southwest Florida, Downing Fry Realty, which produces yearly real estate transactions of over $1 billion. Jim, Michael, and Morgan make up the York Real Estate Group of Downing Fry Realty, with over $275 million in sales transactions, along with offering over 25 combined years' experience in the local market. The Yorks can offer the experience and trust you need in a realtor. Call them today at 239-273-6727 or visit their website at www.naplesyorkrealestate.com.